afternoon, everybody. Welcome to the last part of this webinar today. So for the last 3 weeks, we've been spending a lot of time talking about Breast Cancer Awareness Month. So I have a few links that I'm getting ready to share on the True Solitude 1000 group page this morning, afternoon, evening, wherever your time zone may be. And then there's a few videos because today's topic we're going to be touching on, we're going to talk about mammograms today. So let me go ahead and share the links of the website that I have on this presentation, everybody. So give me a few minutes. Let me stop sharing my screen real quick. So I'm going to go ahead and put this in the comments section of the True Solitude 1000 group page, everybody. All right. So we got this one here. And then we have one more link I want to share with you all. So you can kind of go into and see what it really looks like with mammograms and how that takes a plot. I'm going to show a few videos too to give you a diagram of it, everybody. So let me go back. Share this screen. Also, too, we'll take a quick admission. We're going to go into domestic violence awareness as well. And kind of talk about that. So the first video I'm going to show is your first mammogram test. How does that experience feel? Do you have concerns? So here's a couple of videos I'm going to share this afternoon to kind of give you an insight of what this is like and what to expect. And you always can ask questions during the process. The tech is very open. Majority will answer questions you may have or concerns that you may have. It's your very first time getting a mammogram.
Putting it off for weeks, just like you. We're busy people. I'm a mom of two. I just don't have the time. Plus, I am a little nervous. I have no idea what to expect. But the truth is, it's just smart. Early detection does save lives. So here's what I did. I made myself an appointment at Johns Hopkins Medical Imaging. I went online to my chart. I picked the date, time, and location. So simple. So, I'm going. And you're coming with me.
Here at Johns Hopkins, we support that women at average risk for breast cancer should start annual mammograms at age 40. That's really important because we know that annual mammograms has the greatest chance to detect breast cancer early. And when we detect breast cancer early through screening, we know that that's when it's the most treatable.
Hey, welcome to Johns Hopkins. How can I help you today?
I have an appointment.
Okay. I just need you to sign in right here on this computer.
Okay.
We know that this type of exam can make women nervous. From the moment you walk in the door, we aim to make you comfortable.
Oh, okay. All right.
Thank you. Everything you're going to need is right here in your dressing area. You got your gown. Everything's going to be changed up before we step off. We also have a robe for you to put on so you don't get too cold or chilly. And did you have any children?
No, I was told not to wear it. Yeah.
Perfect. Wonderful. Well, I'm going to have you go ahead and get changed. I'll be right back with you in a few minutes. Okay.
Sounds good. Thank you.
You're welcome. Every single technologist is trained and specialized in this type of exam, and that is all we do. We're going to start with the right side. Okay. I'm just going to come around you here.
Okay.
I'm going to have you take your right arm. I just want you to grab right here for me. Bend your elbow, and I want you to lean in on this corner. Perfect. Perfect. Just going to come underneath this. After doing mammography for many, many years, we are trained in little tiny tricks in how to move the patient's breast around, how to move them in perfect position, how to compress them a little differently so that they are very, very comfortable. A little swoosh, but it's going to be very quick. Having a really experienced technologist performing the mammogram is very important for us. The positioning, I can't emphasize enough, is crucial to us being able to interpret the mammogram appropriately. Are you doing okay?
Yes. Yeah. Fine.
Great. All right, I'm just going to ask you to hold still just like that for me. We're going to take a quick picture and just hold your breath. When a woman gets a mammogram, 4 total pictures are taken, 2 pictures of each breast. Each of those pictures on a 2D mammogram is just one picture to look at.
On a 3D image, you're able to scroll through that image and see multiple layers within that one image. So a 3D image really helps clarify for us as radiologists whether a finding might just be overlapping tissue or whether there could be a mass under there.
You may breathe.
Hey, not so bad.
Doing okay?
Yes, thank you.
Fabulous. We are all
At Johns
finished.
Hopkins, all of our breast imagers are breast imaging specialists. And that's important because it's well known that radiologists who exclusively read breast imaging and read a higher volume of breast imaging have a higher cancer detection rate. And that means that we're picking up more cancers.
What was I worried about? I have no idea. It was so fast, so easy. It was just a little squish for about 4 seconds. The tech told me everything that was going to happen, which was awesome.
If there's any additional findings on your mammogram, we will actually call you to let you know so we can bring you back in for any additional imaging that you might need.
After a patient has their mammogram, it's read by the radiologist usually the next day. In 90% of cases, the images look great and normal and the patient is notified by mail. In about 10% of cases, we need to clarify an additional finding, so the patient needs to come back to return for additional imaging.
Once the radiologist has read their report, the results will go to your doctor within 24 hours.
Okay.
A screening mammogram takes less than 5 minutes. It's not that uncomfortable and it saves lives.
You know what? I could totally do that once a year. It feels good to know what's going on with my health.
All right, moving on to the next video.
Memorial Imaging Women's Center locations provide cutting-edge technology. A mammogram is an X-ray of the breast. It's also an invaluable tool for early cancer detection. Screening mammography is used to detect breast changes in women who have no signs or symptoms of breast abnormalities. The goal is to detect cancer before clinical signs are noticeable. The average woman should begin her annual screening mammogram at the age of 40. If there's a family history of breast cancer, screening should start much earlier. Your physician can determine the appropriate age for you to establish your baseline mammogram and begin with annual follow-ups. Our imaging centers deliver cutting-edge technology that produces only 3D screening mammograms. Called tomosynthesis, or TOMO, these images can be viewed one layer at a time and as a full 2D composite. Each breast tissue layer is examined carefully for any potential abnormalities. All our mammograms are conducted by a breast-dedicated technologist. 3D mammograms produce higher quality breast images with less recalls, enabling potential earlier cancer detection. 3D mammography produces 1 mm slices of the breast tissue for more thorough examination. All breast mammograms are interpreted by a breast-dedicated fellowship-trained radiologist. Should your screening mammogram show an area of concern, you'll be referred for additional tests, including a diagnostic mammogram, which is used to screen high-risk patients, or patients that have an existing abnormality. This 3D test includes a greater number of images and angles. To prepare for your 3D screening mammogram, your doctor may recommend that you schedule the test for a time when your breasts are least likely to be tender. If you haven't gone through menopause, that's usually during the week after your menstrual period. Your breasts are most likely to be tender the week before and the week during your period. Make sure you bring a copy of your prescription, your insurance information, and a picture ID. If your last mammogram was taken at a Memorial Healthcare System facility, your records are stored and accessible from any location. If you have prior mammogram images and reports obtained from non-Memorial facilities, please bring these images and reports on a CD. We recommend that our radiologists have access to past images for comparison. Do not use deodorant before your mammogram. Avoid using antiperspirants, powders, lotions, creams, or perfumes under your arms or on your breasts. Metallic particles in powders and deodorants could cause inaccurate readings. At Memorial Healthcare System, we value your time. and we make every effort to ensure that your appointment is timely and easy to schedule. You have the option to fill in all your medical information before you arrive by taking advantage of Memorial's My Chart portal found on our website. You can also enter your information at one of our women's imaging centers using dedicated turnkey sign-in tablets used exclusively by our screening mammogram patients. A screening mammogram is non-invasive and quick, often taking no more than 20 minutes. Once you're moved into a mammogram room, you'll be asked to remove all upper clothing and any jewelry. You'll be given a gown designated for medical exams and procedures. A breast technologist will place the breasts, one at a time, between two plates. One of the plates takes the image, and the other keeps the breast in place. The technologist will take images top to bottom and side to side of each breast. While the breast is in place, it is compressed to keep it stable and to provide a better image. If your procedure is a 3D diagnostic mammogram, the process will likely take a little longer as the breast technologist will be taking multi-angle images of each breast. During any mammogram, you will likely feel a little discomfort, which is normal. Our breast-dedicated technologists are trained with the latest technology, which produces a more comfortable experience to minimize any discomfort. All images will be stored and available at any Memorial Healthcare System facility. Your test results will be shared with your ordering provider and will be available to you within 2 to 3 days. Patients also have access to their report using Memorial's My Chart portal. The majority of our diagnostic mammogram patients receive results the same day, often before leaving their appointment. When you're ready to schedule your mammogram and you have your physician's prescription, simply call Memorial Centralized Scheduling. An appointment can be made at your choice of women's imaging center locations. You will also have the option of scheduling directly online. Your doctor can also schedule your mammogram, often the same day. Our Tomo 3D screening is faster and produces more accurate results. Images are sharper and more detailed. This system produces fewer false positives, which means less retesting is needed. Most important is the potential for earlier cancer detection and treatment. Every Memorial Women's Imaging Center is a breast imaging center of excellence, ACR accredited, NAPBC accredited, and every radiologist that analyzes screening or diagnostic mammograms is breast dedicated and fellowship trained and board certified. At Memorial Healthcare System, we offer price transparency because we believe the cost of healthcare should be available before a patient makes a choice.
All right. Moving on. So the imaging of early detection of mammogram.
There are many ways of approaching breast imaging, and because there's so many technologies, people get confused.
The standard screening method for women is the X-ray imaging of the breast, or mammography. Mammography is fantastic at identifying little tiny white dots on the mammogram, which represent calcification, the earliest stage of breast cancer. A weakness of mammography would be in the setting of a woman who has very dense breast tissue. And that's because dense-breasted women have mammograms that are almost entirely white. And so cancer, which is also often seen as a white abnormality, is harder to detect. That said, it is still a very good test for screening all women and has been shown to reduce mortality from breast cancer.
Another way of looking for breast cancer is with breast ultrasound. Although mammography can find many breast cancers, sometimes ultrasound actually will find others. The problem is that it will miss those little calcium particles. Now there's other ways of looking at the breast besides mammography and ultrasound. One is MRI. And MRI uses strong magnets to look through the breast tissue, and they give contrast in the arm. And what happens is that those cancers will light up bright, and so it will show us little cancers that can't be seen any other way. But I ought to say, you can't just get the MRI. And the reason is because it will miss the earliest form of breast cancer shown by mammography and calcifications.
This lateral picture.
There's a new technology called 3D mammography, or also called tomosynthesis, and it's something that we've just recently started offering at Stanford.
Take in a breath and hold it.
In the early clinical trials, the data has shown that this new technology decreases false positives and increases cancer detection, regardless of a woman's breast density.
The way that you take it, tomosynthesis, is the breast is compressed, and then you have extra pictures taken like this. The images will produce little areas of pictures through the breast so that we can see every little bit of it. And it's been shown in studies that tomosynthesis can increase the detection of breast cancer by about 25 to 27%. That's huge. Plus, it decreases the number of false positives between 15 and 17%.
Recommendations for screening are generally based on a woman's risk for breast cancer. Various factors play into a woman's risk for breast cancer, including her age, her family history of breast cancer, family history of ovarian cancer, her breast density, and then any genetic predisposition to breast cancer, such as a BRCA mutation.
At Stanford, we're going to use all of our technology, all of our research, all of our experience to try and do our very best for every woman to find breast cancer early and cure it.
All right, we have one more video. This video here shows you how to read a mammogram. This is just an awareness and something to kind of make you aware of how it's read, okay?
How to read a mammogram, brought to you by Mammo Guide. Interpreting a mammogram is the most basic skill in breast imaging. Everyone says you need a systematic approach, but nobody tells you what that approach is. So today, in the next 5 minutes, we are going to teach you a super useful, comprehensive approach to reading a mammogram. This isn't the only way to do it, but it is one way, and a good way, to ensure you don't miss anything. So here we go. First, you want to start by making sure that images are technically okay. A few general requirements. You want to ensure adequate compression, no motion or artifacts, and correct technique. The images aren't too dark, they're not too light. Next, on the MLO view, you want to look and make sure the pectoralis muscle goes down to the level of the nipple. Next, you want to ensure that the inframammary fold is open and not drooping. Next, you want to make sure that the glandular tissue is not cut off posteriorly. Switching our attention to the cranial caudal view, the posterior nipple line is a line drawn from the nipple to the back of the image on the cranial caudal view. This should be within 1 centimeter of the distance from the nipple to the bottom of the pectoralis muscle on the MLO view. Next, you want to ensure you see a little bit of retroglandular fat at the posterior aspect of the cranial caudal view. You want to ensure that you include adequate coverage of the medial tissue. And finally, you want to ensure that the nipple is in profile. Next, once you've ensured that the mammogram is technically okay, you want to take a quick general overview of the image. We like to use the 3 S's, looking at size, symmetry, and surgery. Compare the breast side to side. From here, you're going to compare with prior studies. The more prior exams you can obtain, the better. You want to ensure that you can at least go back 2 years. If you see a small mass or asymmetry that's been on the images for several years, you're done. No further workup is required. From here, you're going to look closer at the MLO view. We're going to employ a technique called shade symmetry. We are going to look specifically only at 1/3 of the breast at a time. When you first do this, you may want to actually take a piece of paper and cover the rest of the breast. This will allow you to really focus in and compare side to side with the right and left breast. So we're going to start looking at the upper third, then moving to the middle third of the breast, and finally to the lower third of the breast. From here, we're going to magnify the image and again repeat those same steps, looking at the upper third, the middle third, and the lower third of the breast. In this magnified view, we're looking specifically for groups of calcification. From here, we are going to look at the five key spots that we want to ensure we include in our evaluation of every MLO view. First, we want to look specifically at the axilla. Next, we're going to look closer at the nipple subareolar region. Approximately 20% of cancers occur in this region, and they can be very difficult to detect. From here, we're going to look at the edge of the glandular cone. At this interface is where the majority of breast cancers occur, so you want to ensure that your eyes make a rim around the outside of this glandular tissue. Next, we're going to look a little closer at some danger zones. These are areas of fatty tissue where really nothing should occur. That includes the retroglandular fat, the fat superior and inferior to the glandular tissue, as well as taking a quick look around the skin and edge of the film for any abnormalities. And the final step of evaluating the MLO view is to look for the whitest, brightest thing on the film. This is just a little trick, but it's amazing how often cancers will appear as the brightest thing on the film. From here, we're going to look a little closer at the cranial caudal view. We're going to employ that same shade symmetry technique, this time starting looking at the lateral third of the breast. From here, moving to the middle third, and finally to the medial third of the breast. Next, we're going to magnify the image and again repeat those same steps, but specifically looking for calcifications in the lateral aspect, the middle third, and finally the medial third. Then we want to make sure we look at the 5 key spots not to be missed on the cranial caudal view. And these include the lateral breast, as the majority of breast cancers occur out laterally. Next, we're going to look again closer in that nipple subareolar region. From there, we're going to do this edge of the glandular cone. Again, at that interface, a majority of cancers occur. From here, we want to look at the danger zones, the areas of fatty tissue where nothing should be present. This includes the retroglandular fat, the medial breast, and again, looking at the skin and edge of the film for any subtle findings. Finally, once again, we want to look for the whitest thing on the film. Finally, we want to look at any tomosynthesis images. If you have these 3D images available, you want to scroll through the cine images, and with this you're particularly looking for areas of architectural distortion. And then finally, if you have not done it already, you want to look at any computer-aided detection. So click the CAD on and off and just give a quick second look to any area that's marked. The vast majority of these markings you can ignore, but every once in a while it will highlight an area that you may have overlooked. Again, this is how to read a mammogram. For more information, please visit us at mammoguide.com. There is this handy PDF document available for free at mammoguide.com. Thank you. How to read a mammogram, brought to you.
Alright, everybody, that completes that slide. Stop. So we'll take a quick break and get into the domestic violence webinar. Stay tuned. I'm back. So this is the second portion of the webinar. As you know, Breast Cancer Awareness Month is in the month of October, but also too, Domestic Violence Awareness Month is also in the month of October too. So we'll talk a little bit about it on this platform. You may have seen the other platforms on social media, Instagram, YouTube, Facebook, Twitter, and maybe some on Snapchat, some of the video footages. So we're going to share some information on here because I want to get right to the point on this presentation because everybody's been sharing it and I want to make the awareness for you all to understand. Okay. So what you see right here talks about control tactics. So you have the children, relationship, stalking, property, pets, psychological, economical, sexual, and physical, and legal. So all these different factors have something. So I'm going to read an example of each one, starting with the children. Punish to hurt the victim. Relationship, discredit character, stalking, GPS tracker. Property says pet is damaging property. Psychological means verbal attack. Economic means control of money. Sexual means extreme jealousy. Physical means driving recklessly. Legal means lie to the police. And then the last one is isolation, early to control without support. So each one of these that I talked about are some of the key examples on the control factor of that, and the types of abuse that you see here in the pinwheel. In this section, it talks about the types of type domestic violence of intimacy, terror, IT suppress, violent restriction, situation, couple violence, and mutual violence. So some of these key factors are those different types. The next one, as you can see here, is using coercion and threatening, using intimidation, using emotional abuse, using isolation, minimizing, denying, and blaming, using children, using male privileges, and using economic abuse. So some of these factors, all these factors here, it talks about that. And it talks about it's the physical as well as the sexual abuse that is being talked about here. So these are very sensitive topics, very informative, very important, and some of the stories I've shared on my platform yesterday. There's a lot of people who are advocacy, and I'm one of the ones who advocate this as domestic violence awareness as well as breast cancer. These are important conversations to continue to have around your platform, and make sure you share that before the end of October and even beyond that, so people can be self-aware, people can be educated, and can identify some of the things that are not really good about it at all. Okay, so I have a quick video I want to share with you all to give you a little illustration of different types of domestic violence, identify them, and help to get. And I have a few websites I want to share with you all too. I want to put that in the comment section of this live.
October is known for being Breast Cancer Awareness Month, but it's also Domestic Violence Awareness Month, and we're talking about it today to help unmask the problem and try to prevent it. Susan Kidder is CEO of Safe Connections. Thank you so much for being here. Let's start out, what is domestic violence? You've been telling me there are even different types.
Right, well, domestic violence is a pattern of assaulted and coercive behaviors that an abuser uses to control their intimate partner.
And there are money, knows where all the stocks are, knows where the property titles are, and make sure that they control that economic or that financial piece of the relationship. And this is a targeted thing that someone does.
You're absolutely right. That's what makes it a pattern, and it is specifically targeting the intimate partner violence, or excuse me, intimate partner, because this is not an anger issue. This is not something that you see at the bank with the teller or at the grocery store with the clerk. This is a very intentional, targeted behavior.
Okay. What would the warning signs be? So how would I identify myself as being a victim?
Isolation is a big part of this. Are you being isolated or attempts being made to isolate you from friends, from family, from your support network? Threats are also huge red flags. Feeling like you're in a coercive situation where you're not really allowed to control where you go, who you see, who you're with.
And you even say constant put downs, those subtle little things that are said.
Absolutely, which leads to the other term of gaslighting, which is you're fat, you're ugly, no one will want you, the kids hate you, you're incompetent. All those kinds of things that are put down in the negative, and really the strongest person on the face of the earth, subjected to that, will begin to believe it.
And be worn out. Quickly,
Right.
what should someone do if they know someone who is this is happening to,
Sure.
or it's happening to them?
The first is to believe them. Believe them, be their trusted friend, and listen without judgment. Don't question why they're still in a relationship. Listen to them and help them work on a safety plan if that's something that the person wants to do. And certainly call Safe Connections. Our 24-hour crisis helpline is there for survivors and also for people who love survivors and want to know how to help them.
All right, Susan Kidder, let's hope we can talk about this as much as we do about breast cancer in the month of October.
Right.
Thank you so much for
Thank
being
you.
here. All right.
All right, everybody. So these are the 3 links that I shared in the comment section of this webinar today. So we did the Breast Cancer Awareness Month webinar, and then we tied in and took a quick intermission and jumped right into the domestic violence awareness resources and the information I shared with you today. There's so much information about this. It's been talked about on my main page for the last few weeks. So all the information that you have seen on the month of October is giving you insight, everybody. Okay? All right, ladies on the True Solitude 1000, have an amazing and a wonderful day. I love you all, and I'll talk to you all soon. Take care.